Where Your Energy is an educational platform to learn about the psychology of humans for mental health and well-being.
Body image distress is often seen as a symptom of an eating disorder. However, not every person with an eating disorder has a problematic body image, and many people who do not have eating disorders have poor body image. What is body image? Body image is the subjective image people have of their own body, which is distinct from how their body actually appears. A healthy body image involves an objective perception of one's appearance and the ability to separate one's value as a person from how one looks. Negative body image is often characterized by dissatisfaction with appearance and engaging in behaviors such as dieting, checking, and/or avoidance, in an attempt to ameliorate the dissatisfaction. Negative body image often emerges during childhood. Studies show that approximately 50% of pre-adolescent girls and 30% of boys dislike their bodies. Around 60% of adult women and 40% of adult men have a negative body image. The term normative discontent was first used by Rodin and colleagues in 1984 to describe dissatisfaction with body size and shape. It was found to be so widespread among women that it was determined to be normative or normal. A recent large-scale study of 18 to 79-year-old Icelanders showed that nearly 43% were dissatisfied with their body weight, and over 71% thought they needed to lose weight. Body image issues in eating disorders. Eating disorders are complex mental illnesses caused by genetic as well as environmental factors. Negative body image is just one potential contributor. This over-evaluation of shape and weight is a symptom of some, but not all, eating disorders. One's self-evaluation being disproportionately influenced by body shape and weight is consistent with a diagnosis of either anorexia nervosa or bulimia nervosa. Anorexia, a diagnosis of anorexia nervosa is additionally consistent with a disturbance in how one's body weight or shape is experienced or an inability to recognize the seriousness of the current low body weight. Binge eating disorder. Over-evaluation of shape and weight is not required for binge eating disorder, BED, the most common eating disorder. Research indicates that only about 60% of BED patients met the criteria for over-evaluation of shape and weight. For avoidance restrictive food intake disorder. People with the eating disorder avoidant restrictive food intake disorder, ARFID, do not typically experience any preoccupation with shape and weight. How the media affects body image. Negative body image and other disorders. Body dissatisfaction may lead to dieting and disordered eating, which can be gateway behaviors to an eating disorder. Body dissatisfaction is not only a risk factor for or symptom of an eating disorder, but it can also be a risk factor for depression, anxiety, and low self-esteem. Thus, it is a common target for prevention efforts. Body dysmorphic disorder, BDD, is another psychiatric disorder, classified as a type of obsessive-compulsive and related disorders. People with BDD are preoccupied with one or more non-existent or slight defects or flaws in their physical appearance, including body shape. To be diagnosed with BDD, a person must engage in repetitive behaviors, such as checking or reassurance seeking, related to the preoccupation. Experience impairment in functioning. Muscle dysmorphia. Body weight and size dissatisfaction have long been recognized as an issue among women, but it has recently been identified as an increasing problem among men. Treatment for negative body image is often one of the last symptoms of an eating disorder to improve during treatment. Even accounting for different treatments and symptoms, the stages of recovery from an eating disorder follow a fairly similar pattern. A variety of interventions have been designed to target a negative body image. These interventions fall into several broad categories, including cognitive behavioral therapy, fitness training, media literacy, self-esteem enhancement, psychoeducation, gratitude. In many cases, treatments incorporate more than one category of intervention. For example, cognitive behavioral treatments and media literacy programs often include psychoeducation. Cognitive behavioral interventions are those most frequently utilized to address body image. These interventions help individuals modify dysfunctional thoughts, feelings, and behaviors that contribute to negative body image. The techniques used include self-monitoring, cognitive restructuring, body size estimation training, exposure to triggers, mirror exposure. Fitness training interventions include exercises geared at improving physical capabilities such as muscle strength. Objective improvements in physical fitness are not as important as perceived improvements. Media literacy interventions teach individuals to critically evaluate and challenge the media images and messages that can contribute to negative body image. For example, images of very thin models and messages such as "thin is beautiful" can be challenged. Self-esteem interventions used in the treatment of negative body image focus on identifying and appreciating individual differences both in regards to body image and internal qualities and talents. Strategies also focus on building healthy coping skills. Psychoeducation strategies teach individuals about issues related to negative body image, including its causes and consequences. Psychoeducational strategies are often used in combination with one of the other types of interventions. Gratitude-based interventions. A newer line of body image interventions includes gratitude-based strategies such as gratitude journals, lists, reflections, and meditations. Strategies to try at home. Here are some self-help strategies based on some of the interventions above that you can do on your own to improve body image. Keep a body gratitude journal. A daily routine that includes self-deprecating comments about your body is likely making you feel worse. In order to come to a more balanced perspective, it is important to start to shift your attention and appreciate good things about your body. One way to achieve this is to keep a body gratitude journal. Try to write something daily that is positive about your body. Examples of body gratitude. You can include things like, "I had a good hair day, my legs allowed me to hike up the canyon," or "my arms allowed me to hug my child." Clean your social media feed. People often face a daily barrage of images and messages emphasizing thinness and/or the attainment of an ideal physique. Buy clothes that fit now. Many people resist buying clothes that fit and either wear shapeless clothes or dangle themselves the reward of shopping or fitting into old clothes. When they lose the weight, this misguided exercise increases misery in the present and does nothing to increase motivation. Challenge avoidance and stop body checking. Avoidance and body checking have been implicated in the persistence of eating disorders. Avoidance can involve the complete covering up, refusing to wear appropriate clothes for the situation, wearing a hoodie in the summer, refusing to wear shorts or a sleeveless top on a summer day. Refusal to swim because of anxiety over wearing a swimsuit, or complete avoidance of doctors who might weigh them. Avoidance and body checking only perpetuate anxiety. The goal should be moderation. Those who avoid should practice exposure, and those who obsessively check should stop. Act out against the thin ideal. Some of the most effective eating disorder prevention programs, such as the Body Project, are based on the principle of cognitive dissonance. Cognitive dissonance is the idea that when attitudes and behaviors conflict, a person experiences discomfort and tries to align attitudes with behaviors. Change negative body language. Engaging in typical fat talk, negative and judgmental comments or conversations focused on weight and appearance, is detrimental to body image. Avoiding such judgments, for example, "I'm so fat," can improve body image. Consider taking a pledge not to engage in fat talk. A word from Wear Your Energy. There are numerous movements suggesting people should aim to love their bodies. This may not be possible. A more reasonable goal for some might be to work toward appreciating and accepting their bodies. Body image will not likely improve without effort, and the above activities must be performed over time. Don't hesitate to seek help from a professional.
For further video updates on mental health and wellness, visit us for further queries related to mental health.